In this video, I discuss your health insurance options if you retire early. Coming up next on Holy Schmidt.
Holy Schmidt!
If you retire before age 65, you'll need to cover your health insurance costs and out-of-pocket costs before Medicare kicks in. And for many retirees, this is the single most expensive and confusing part of retirement, at least early retirement. In this video, I'll walk you through the 8 main insurance options for retirees with a special focus on cost, timing, and risk. We'll also talk about what happens after retirement when Medicare kicks in. By the end of this video, you'll have a clear path forward whether you're planning for a few months or a few years ahead, or you've just suddenly been laid off. All right, let's get into it. Option number 1, employer-sponsored health insurance plans. Now, if you're lucky enough to have an employer that covers your health insurance when you retire, this is the ideal situation. Oftentimes, especially when there is a union involved, post-work health insurance is covered by the employer until the employee gets to age 65. The big benefit here is cost. The employer will cover a significant portion of the health insurance premium until you reach 65 anyway, and that coverage will look very similar in most cases to what you had when you worked for the company. Option number 2, join your spouse's medical plan. Now, if you're retiring and your spouse is still working, this is often the best bet, both from a cost and a coverage perspective. Spousal coverage is usually easy to add during open enrollment or within 30 days of the spouse leaving their previous place of employment. Most employer health plans are subsidized, which means that that point alone could mean that you're paying thousands less simply by going on your spouse's plan rather than seeking your own plan outside of an employer. Also, this route is low stress. If you're going through a job change, this is often very stressful, particularly if it wasn't your choice, and having a low stress option to continue a very important part of your retirement coverage is super important. Option number 3, the ACA Marketplace Health Coverage Plan. If you don't have coverage through your previous employer or your spouse's employer, this may be the option for you. These plans are available in every state, and the premium is based largely on income, so if you retire early and you don't have an income, well, this might be the route you're looking for. You can enroll during open enrollment, and if you lose your previous coverage, a special window opens up for you. Option 4, COBRA coverage. COBRA lets you keep your old health insurance, but there's a catch. You pay for everything, and it's generally pretty expensive because people that use COBRA versus other options often don't have other options. So if you keep it for the 18 months, it's going to be quite expensive in most cases, but people often will stay on COBRA for a short period of time until they figure out their own health insurance. Option number 5 is Medicaid, if you qualify. Medicaid is a public health insurance program for low-income individuals and families, and if your income is low enough in retirement, you might qualify. Each state runs its own Medicaid program, and so the rules and the benefits will vary state by state. Some states have expanded Medicaid under the ACA, which means that people in those states may be able to qualify based on income alone. The upside is that there's very low or no premiums, low out-of-pocket costs, and broad coverage. The downside is that not all doctors accept Medicaid, and in some states there might be asset tests needed to qualify for Medicaid. Option 6 is part-time work with benefits. Some employers will offer you health insurance even if you work for them part-time, and these are pretty well-known companies like Starbucks or Costco. If you're retiring and you want to earn a little bit of extra income or you just want to stay active, this is a really good option because if you get in with one of these companies, you get both the income and the healthcare benefits. And if this sounds like you, you're not alone. According to the Federal Reserve, 11% of retirees work some form of a part-time job. Option 7, healthcare sharing ministries. Now, these are faith-based healthcare plans, and the members contribute to the pool, and the pool is what's used to pay for the medical costs of the members. This type of insurance is much cheaper in many cases than a regular healthcare plan, but be careful because even though it's cheaper, it's not regulated in the same way. The bottom line here is that it may work, but it's more of a community model than a legal insurance plan, so just go in with your eyes wide open. Option 8, short-term health insurance plans. Short-term plans are usually for 364 days or less and renewable up to 3 years. They're cheaper, but they don't cover everything. In fact, most don't cover things like maternity and mental health coverage. If you're healthy and just need coverage for a short period of time, it's an option, but just use caution. Most retirees find better value in the ACA marketplace or on their spouse's plan. Now, once you turn 65, the game changes a bit, and health insurance is covered through Medicare. Most people sign up for Medicare Part A and B and then add either a Medigap policy or a Medicare Advantage policy. A Medigap policy looks a lot like a health insurance plan that you can use anywhere in the U.S. A Medicare Advantage plan is regional in nature and it looks a little bit more like an HMO. Most people also add Medicare Part D, which covers prescription drugs. Now, these options still have costs, but they're generally lower than what you would find with private insurance. If you're planning on retiring right at age 65, then you'll have no problems. You just transition right onto Medicare. But if you plan on retiring before age 65, then you're going to have to bridge the gap with one of the options that we just talked about. So what's the best option for an early retiree? Well, it's usually their employer's plan, if their employer offers subsidized health insurance once the employee retires, or their spouse's health plan, if that's not available. And if you're on a tight budget, if you have very little income, very little assets usually, then check out your state's Medicaid plan to see if that's the best option for you. And if you're lucky enough to plan ahead, in other words, it's not a forced retirement, check out part-time work with one of the companies that offer health insurance as part of the benefits. Every retiree's situation is different, but if you plan ahead a bit, you can minimize unnecessary costs and big surprises. Now, if you still need more information, go to holyschmidt.com/free report. I have a free download for you called Health Insurance Options in Retirement. It covers off what we talked about in a lot more detail, and it'll give you something to work with. Also, if you like this video, check out that video, things you can do once you turn age 62. This is Jeff Schmidt, and I will see you in that video right there.